Hey everyone, and welcome to Holding the Line with Got Your Six Counseling. I'm Peggy, and this is Brittany. This is a space where we get real about the shit nobody wants to talk about: mental health, life, trauma, healing, and everything in between. Sometimes we get clinical, sometimes we get messy, but it's always honest. Quick reminder, this podcast isn't therapy, and it's not a substitute for professional care. We're not here to provide therapy, diagnose, or treat. If you're struggling with mental health, please reach out to a licensed provider. You don't have to go through it alone. We've got your six. We're just two trauma therapists showing up as humans first, ready to have real, unfiltered conversations about the stuff that matters. We're here to break the stigma, share what we've learned from both sides of the therapy room, and talk about the challenges people face every day, especially in the veteran and first responder communities. Whether it's trauma, burnout, relationships, identity, or just getting through the week, we believe that these conversations matter. They deserve space, and that's what we're holding the line for. So let's dive in.
Hello and welcome back to another episode of Holding the Line with Got Your Six. I'm Brittany and that's Peggy. And today we are giving you episode 2, season 2, episode 2, 2-2. Today's title is Bruh, Teens in Therapy. I do love the word bruh. I say it far too much, I think. Landon told me it was cringy. I'm going to keep saying it. If you've ever mentioned therapy to a teenager, I mean, unless your kid's asking for therapy, in which case you should put them in therapy. However, if you've mentioned it, they're just like, bruh. They say that to a lot of things, but that too.
Exactly. Bruh.
Or they sit in your office like.
Yep. The
right?
long pause, the side eye, the very flat. Or they'll tell you, that's cringy. Stop that.
Yeah. All the words, though, I can't keep up, but bruh is one of my favorite. And it can mean a lot, right? Confusion, disbelief, definitely for me. I guess for teens in therapy, it's like a discomfort thing, like they're unsure of how to trust or, whatever. They're not really sure how to talk about it. So this is an episode about teens in therapy. Why teens react with bruh and their experience. Now, Peggy doesn't see the littles, but you do see some teenagers, right?
I do. And I have teenagers. And
yeah.
Teenagers today are carrying a lot.
They are.
Whether it is academic pressure, social media, identity development, family stress, all of it, like world events, because they're very cognizant of what is going on in the world. I got my teens in therapy going, what do I do with this?
Mm-hmm. I think they're much more aware of what's going on around them more than we ever were, aside from the big historical events. We were living history. Our kids that are teenagers are also living history. They lived through a global pandemic. I don't even know what we're doing right now, but they're living through it. And generationally, they're so different than we were with being and having access to things the way that we didn't. Like, I always joke and say that I was in the last generation that didn't have internet my whole entire life. Right? I didn't have internet until
cell phone.
Right.
I didn't have a cell phone.
Yeah, I didn't have a cell phone until I could pay for it at 17 or 16 or 17. And then, we didn't have the internet or a computer until I don't even know how old I was. It was when my grandfather had built, and we all shared the same
dial-up.
With dial-up, right?
Dial-up.
And if you were mad at your sibling, you could pick up the phone and it would boot them off. Yeah, so I feel like we were the last generation that didn't have that hardcore exposure the way that these kids do, where they're on social media, they're on their phones, they're connected to everything all the time.
Yeah, so it's like constant source after source after source, like what's going on. I do try to limit mine to social media. I'm like, can we not? But I also have I have a very tismy teenager that looks up the most random stuff in the world. I'm like, can we not? He's
I do that too.
He's like, when will the world end? I'm like, no,
nope,
bro.
I'm not asking that. Ignorance is bliss. You feel me? I don't want to know. I joke with my patients all the time, and they're like, oh, did you hear? And I'm like, no, because I don't watch the news. Whatever news I get is from you guys because it stresses me out and gives me anxiety to watch the news, so I do not. But I do be Googling random things because my ADHD brain hears something and then I'm like, what? That can't be true. And I'm like, oh God, penguins do have knees and babies are born without kneecaps. And people are like, why do you know this random stuff? And I'm like, I don't know.
Don't ask.
It's just the way my brain does things. So yeah, they're carrying a lot and their brains are still not fully developed. Their frontal lobe doesn't finish developing until what, you're late in your 20s?
Well, it depends because like females will develop first
Hmm.
and males will develop second, supposedly around 25. I'm still iffy on that. Like, are we developed at 25? I feel like 30 feels better.
Honestly, in terms of like knowing who I was and like me, generally speaking, I don't know that I was comfortable with any of that until I was almost 30. I mean, I did go through a lot of life changes and stuff, but even still, when I look back, I'm like, I didn't know who I was. I don't even know who that is, right? Who
Like
is
for real,
she?
for real. Like I was a dumbass until good and 30.
Yeah, yeah. I mean, I feel like it's the same. And maybe men go longer than we do in terms of like how long it takes them to figure things out. But I digress.
Like, yeah, it's like I'm gonna give that much longer.
Right.
Much longer.
Not a full decade, maybe a couple of years. We'll give you a couple of years grace period. But in terms of kids,
But like the teenagers are expected to like have all these pressures, have all the world events, have all the family crap, and then just hey, you have to act okay, right?
right, right. And oh, that peeves me, because you've got kids that are underdeveloped, like structurally in their brain. They're not even there. We're expecting them to carry all this stuff and regulate their emotions. And some adults I know can't even do that. I mean, the testament to our jobs, even. How many adults do you have that you can think of that have a hard time with doing that? Because we were never taught that. We were never taught that. We were like, sit down, be quiet, don't touch anything, don't ask for anything. And so it makes sense that the rest of us are struggling with that. But our kids are struggling with it too because we're not regulated either. I mean, I guess we are sometimes, but not always. So it's not always the perfect combination there.
And I feel like they're doing a better job at like trying to develop awareness around some of this. Like
Yeah. They have those
using the
social
I
emotional
feel.
thing. Yeah. And then I guess in school, some schools are teaching like that social emotional learning and how it's all connected. And they start that early, but not every school does that. Not every teacher, I'm not throwing shade, is capable of doing that. So it really
Or
just
they have
depends on what's
parents
going on.
that or they have parents that went to therapy.
That, or they have parents that are therapists, apparently.
I'm so sorry to all of you therapists that have to deal with teens that have parents that are therapists.
Sorry in advance. I used to joke that the therapist Landon was seeing, I was like, I'm not paying her enough because I'd come home and hear him like doing his vocals, or he'd come up and tell me what he talked about, and I would just shake my head and be like, I'm not paying her enough. So if you if you're a parent of teens in therapy, I mean, we're on the struggle bus with you. And so I think that especially for you and me, and we get teenagers, I mean, we could technically be their parents, like depending on their age, right?
Oh, and it's so gross. It's so gross.
That and it causes a problem for them, right? Like the whole, if we're circling back to the bra thing and confusion and I don't want to be judged and all that, they see us as another authority figure that is reminiscent of their parents. And so they don't trust them. So why would they trust us, right? So they don't want to be
They don't want
judged.
us report. Yeah, they don't want us
Right.
reporting back to mom and dad.
Because
Like, are you going to tell them?
right, right. And every other situation and interaction they've had with adults up until now who's in an authority position has the ability to run back to their parents and say X, Y, and Z or whatever, where we don't have that. And I try to like push that in when I'm seeing new kids that like, you are my patient and this is all confidential unless, and I'm never going to go behind your back and talk to your parents about something that you're not aware of. And I get a lot of parents that want to meet with me alone without their kid. And I'm like, only if your kid gives me permission. And I am going to be the one asking that because you will. I mean, I would think that, like, as a parent, you're influencing that in some way. I don't want any outside influences. Some kids are like, sure, I don't care. And then other kids are like, absolutely not. I have little ones going,
Or
no.
if you're a good therapist, you're gonna tell the kid, Mom or Dad emailed me today.
I do that. I do that. And I tell my parents that at the beginning. I'm like, listen, I need you to understand that your kid is my patient. You are not. I understand that you are their guardian or their parent or whatever. However, whatever you send me in an email, I'm telling them because if they find out that I knew and didn't tell them, then that breaches our relationship of trust here. And I'm not about to compromise that, especially with a teenager. It takes so long to build that anyway.
Yeah, because a lot of them are confused about like what is therapy actually, because they just kind of like, are you just gonna sit there and look at me?
Yeah.
Maybe.
Yep. And, you know, them not wanting to feel so I was looking and I was just glancing at the outline and it says they don't want to feel broken or labeled. I have one right now that is like terrified of any diagnosis and like he's got siblings that are on the spectrum and he is probably also on the spectrum. I'm not a psychologist, so I can't say for sure, but
Yeah.
neurospicy, neurodivergent knows neurodivergent, you feel me? But he doesn't want to be labeled with that because of the implications of it. And I'm like, you don't have to tell anybody anything you don't want them to know. That's your business. Some people are just being nosy. So you don't, I mean,
And we have it, and you've experienced this more recently than I have. Like we have the now and the later effect, because like what happens now, like if they want to go into the military,
mhm.
just because you got a diagnosis somewhere in your adolescence and teens doesn't mean it's going to be with you forever.
Yeah, no. I mean, nor does anyone really even need to, I mean, I don't want to say they don't need to know, but also, like, if you're going into the military, you were my patient when you were 15, and now you're, 19, and you completed the therapy, you completed your treatment plan, that they can circle back and say, hey, can I get my records? Can you write me a letter? Absolutely. Right? It's not gonna keep you from doing things that you want to do unless you have one of the big ones, like unless you're schizophrenic and then they're not gonna let you in anyway.
Yeah.
Right?
But if
But
it's just, if it's like the anxiety or depression, even some of our trauma ones have overcome some of that.
right, right. Oh no, I lost my outline. That's rude.
Because
Okay,
teens
I'm
aren't,
back.
big message to parents. Teens aren't just rejecting help.
Oh,
They're reacting. They're reacting for fear, uncertainty, and stigma. Because these stigmas don't just happen in the adults.
I feel like it started with them though.
Yeah.
Right? I feel like I say like our generation and the ones that are happening after it were probably, I'm gonna say the first ones, but we were the ones that be like, therapy is okay. Therapy is cool. Y'all need to be in therapy. While our parents are like out here, detached and dissociated all the time because they were never allowed to express emotion or go to therapy. And that meant that you were crazy.
Mhm. Well, because grandma and grandpa might still be giving that
Hmm.
message. They don't need therapy. There's nothing wrong with them.
Right.
Let your children heal. If your grandma and grandpa give you flack for going to therapy, tell them to mind their business.
Yeah, absolutely. And parents contribute to that a little bit too, I think, because okay, as a parent, it's like kids are a reflection of you, they're a reflection of your parenting. And if they need therapy, then you must be doing something wrong. And that's not always true. Sometimes your kids need therapy for something completely unrelated to home life or the way that you're parenting, and it has to do with the pressure academically or socially, or maybe they went through a bad relationship, or you have a ex-spouse somewhere out there that has traumatized them to some degree with their behaviors and or abuse or whatever, right? Doesn't always mean it's you. It's not about you, okay? This is about your kid growing up to be a functionally regulated human. And by kid, I do mean sometimes we get little kids. We're going to talk about that later. I'm not going to get ahead of myself, but right now we're talking about teens. So 13 to, I'm going to say 20, okay? Because I know legally you're an adult at 18, but maybe they
Your
shouldn't.
brain is not.
Yeah, right. So I don't know, we talked about this in our What is Therapy, but what teens actually think therapy is versus what it actually is.
Oh, because their idea is very different than like what an adult's idea is.
Well,
Because an
yeah.
adult knows like you're gonna go in, you're gonna talk, you're gonna get uncomfortable. A teen will sit here and fight you.
But they're not, it's so passive aggressive too. It's like they come in and they sit down on your couch and you're like, how are you? How was your week? And they're like, it was fine. And I'm like, maybe we put your phone down. They're like, probably not. And I'm just like, right?
It's like I will sit there and stare at you. And just stare at you. And they're like, are you just gonna sit here and look at me? Absolutely.
Yeah.
Would you like to talk to me today?
I think those are the ones that their parents are like, my kid needs therapy, right? And then they get real shut down because they're like, I don't want to be here. This is stupid. This is a waste of my
Yeah.
time. This nothing's going to help, right? But then you get the
Yeah.
ones that like ask to go to therapy. I mean, they're both equally rewarding because once you break through the wall of the kids that don't want to be there, it's
Yeah.
good, right? But the kids that want to be there, they come in and they're like, I'm ready. I had this awful week at school and these kids were fighting me, but like, was I right doing that? And I'm like, oh, did you think you were right doing that? You gotta be
The
so
ones that
careful.
But the ones you can't force a teen to talk. Period.
If you have
If
teens,
they
you
don't,
should know this.
yeah. I mean, especially like you're a new adult in their life.
Yes, one that resembles their parents to some degree, right? And so that lack of trust is there from the start. Now, I always find like in the first session they're very forthcoming about like what's going on and how they've been feeling and for the most part, regardless of whichever kid we're talking about. But after that, I used to have this one that would come in every week and she was like, I was like, hello, hi, we were in the same room together. How's your week? And she's like, I just want to play Uno. I'm like, okay, we can play Uno. Which I think brings up another point that depending on the age of the teen you have, they are still very much a kid inside. Because
Yeah.
I mean, Uno is fun for everyone, okay? I'm not discriminating with the Uno. But I had what was she, 16 or 17 at the time?
Most
She
teens want
like
to play still.
she was like playing with slime and doing, I think I had some clay it was just like the primary colors that I bought as like a sample or something. And so she took that and like made a little therapy couch.
Yeah.
And I still have that couch, by the way, out of clay. And so like sometimes teens just want to be teens. And maybe your office is the only place that they can do that because they're not on their phone or they're not on a tablet or a computer or whatever.
Like, are we going to be another adult in their life telling them what to do, how to do it, and what's wrong with them? Because are we just another system, like
Right.
school or anything like that?
No, absolutely not. I don't compare myself to any of that stuff, right? Because we
Exactly.
are the one place that they can come and say whatever they want, however they want. I say however because
Mhm.
some kids, they'll test the waters and they'll come in and they'll say, this always makes me laugh. They'll like drop a cuss word and it's like a real simple one, right? And not like the big one, not the F bomb. And they see that I'm not reacting and I'm not telling them to stop or do whatever. And then after that, every session after that is just vulgar on their part. I'm like, who is this person? And they're like, you can curse too. And I'm like, not while I'm in here with you.
Yeah.
No,
Yeah.
it's okay. We're fine. We're fine. But I think that goes back to like us reporting on them, us telling on them, again, with the system. I'm not going to rat you out to your parents that you're cursing. If you're cursing so loud that the people in the suite next to us can hear you and your parents in the waiting room, they're probably hearing you too. But they don't care, right? This is the one, I tell them, this is the one place that you can say anything, right? I'm not going to judge you. And if it's something that I'm concerned about, then we're going to have a conversation. I'm not going to be like, okay, now I'm going to run out and talk to your mom or dad and tell them everything you just said, or that you want to hurt yourself or someone else, or that you started cutting again, right? Like, we're having that conversation with them because I want to empower them to be able to do that on their own, which is the idea behind it for me, right? Being told what's wrong with them was another one that we
Ugh,
put
yeah.
down. I think that depends on the kid, where they're like, well, I need to know why I'm this way. I don't know why you're this way. This is why you're here. I just met you, right? And also, you won't share anything with me, so how am I supposed to know why you are this way? And then they get real uncomfortable when you make them uncomfortable. And I mean really uncomfortable.
So fun though.
It's a balancing act always. How much can I challenge or confront versus how much am I just holding it for you? But we're not making any progress because I'm just holding the space for you all the time. So there's a shift for sure. And kids don't like that. I say kids, teenagers. Because they're like, whoa, that gives me feelings.
When they actually get to learn how to deal with their stress, their anxiety, and their overwhelm, learning actual skills that they get to apply and seeing what that's like.
Yeah. And I think in line with that, if you have a child in therapy, or you're thinking about putting your kid in therapy, and your kid's therapist looks at you and says, we learned this skill today in therapy, and they gave me permission to talk to you about it, right? And they go home and try to incorporate it, and you get in your feelings because you feel like you're being disrespected. I feel like maybe that's a call for you to also join therapy somewhere, right? Because they're learning how to regulate their emotion and some distress tolerance or whatever, right? That's the one I always get kickback or pushback with from parents, is like, if there's lots of conflict and I'm teaching your child DBT skills, distress tolerance, where one of them is to literally just remove yourself from the situation, and
Oh
when
my
it's no longer
goodness.
productive, right?
Yeah.
But some parents see that as disrespect when they're like, I have to walk away or I need to go, right?
Yeah,
And they're
because
like,
they're
no,
needing a
don't walk away from me,
timeout.
right? And they're like, don't walk away from me. I understand that that can also be disrespectful when they're doing it, but right now they're trying to hone and what's the word I'm looking for, perfect a skill that will be useful for them later in life as well. So, okay, fine. We have conflict. You need to walk away. Got it. Let's come back in a few minutes and see where we're both at. You know, be supportive of it instead of internalizing it, because it's not
Because
about you.
they're still learning to understand their emotions instead of being ruled by
And
them.
communicate them.
Because holy crap, puberty sucks. Oh my goodness. There's so much puberty in my house right now, and I just really want to run away.
I mean, I feel like that's the benefit of having kids. Like Landon and Kylie are so far apart, like 7 years apart. So
Yeah,
Landon is
whereas
struggling that now. Yeah.
I am actively going through it with two of them, and I'm like, I hate both of y'all because.
Although I do dread the day that Kylie enters that realm. Absolutely not. God forbid, Sawyer. I'm gonna be in your place. I'm gonna be in, because they're gonna be hitting it real close to each
Right at
other,
the same,
back
yeah,
to back,
real close, back to back.
back to back,
And
sis.
it's not fun when there's two of them in two different stages of this crap. And like, one's hormones are in like outer space, he's going off the rails, and the other one's doing some other stupid stuff. And I'm like, one at a time.
Can I
One at a
get a
time.
break here?
So parents, you're not alone in this. So that's what we're trying to help them understand, because it is fluctuation of hormones. Their emotions, they are being controlled by it right now, and they don't understand where to place any of that.
Yeah. And maybe you have done a phenomenal job fostering this safe place for your kids as a parent, mom, dad, whatever, that they come talk to you about anything and everything. And sometimes it's too much. That's where I'm at with Landon.
Way too
I'm like,
much.
honey, that a little too much information. But I love that he feels safe and comfortable enough to come talk to me about these things instead of holding it in, right? Also, the fact that we're therapists probably helps a little bit, but he was doing that
The
before. So,
parent with the penis needs these questions and not me.
yeah, especially if the kid has a penis, because I do not have one. So, I don't know what that's like. Okay. But them just having a space that's theirs, right? Like you said, they're learning how to deal with stress, anger, overwhelm, all the emotions that maybe they don't know how to handle. And this is the space. This is your space, even for adults, kids, whatever, because maybe in their life, they never get someone's fully undivided attention for a period of time. And I don't know, I'll think to myself sometimes, I get impostery and I'm like, we're not really doing much. But it's the stuff that you don't see happening that sometimes has the biggest impact because you see them get so much better over a period of time and you're like, we haven't really worked on a lot of like deep core issues, but you've taught them skills. They've talked to you about this and this is the space where I'm not going to judge you unless you're trying to put blinker fluid in your car. And then I have to be the one to tell you that they trolled you and blinker fluid is not a thing.
AutoZone, you can buy a thing of blinker fluid now.
I listen, this one, bless her heart, she was like, I don't have any life skills. And I'm like, what do you mean? And she's like, I don't know how to wash my clothes. I don't know how to do this. And then she starts driving and she's like, well, what about this or what about that? And I'm just like, okay, grad school didn't prepare me to be like an auto mechanic and this and that. But also, that's where the random knowledge comes in, Peggy. See? See? I'm like, did you know? Okay, blinker fluid's not a real thing. If someone has told, I got caught up in that too one time. That blinker fluid was a thing. So yeah, it's okay. Everybody gets trolled every now and then. However, I'm not judging you or anything you say.
Judging.
Sometimes, but only if. But and I'm gonna tell you though. I'm gonna tell you that I'm judging. I'm not gonna just hold it inside and be like, really? What do you mean? And I'm like, oh gosh, we're past this point. But I had to teach my brother-in-law how to put air in his tires and change his wiper blades at like he was in his mid 20s. So listen, maybe it never stops for some. But we're teaching them to understand emotions, put a name to it, verbalize it. So you're not ruled by them anymore. It's much more regulating to know instead of
We're
just
not,
feeling angry all the time. There's bigger and more complex
yeah.
emotions behind it.
And especially with teens, we're not telling them how they feel. We're letting them label the emotions, the feelings, letting them place it where they want to place it. Because too oftentimes, teens especially are told how to feel and what they feel and when.
Right. And when they were little, they were told when they were upset or showing big emotions, and this makes my skin crawl. When I hear a child crying or they're upset about something, instead of just being that co-regulated human there with them until they have words for how they're feeling, it's like, stop it. You're fine. Right? Guilty of that. Okay. I used to do that until I realized and learned that that only teaches kids to suppress their emotions further, deeper inside, and they don't feel safe expressing it. So it's like, don't, stop telling your kids that. You're fine. Stop crying. No, let them cry. They're not fine. Obviously, they're crying. What can I do? What's going on? Do you want to talk about it? Not tell me. Do you want to talk about it? It gives them the autonomy to choose. And maybe 9 times out of 10, they're going to talk to you about it, but maybe that 1 in 10 is not. And that's fine. I'll be here when you're ready. Lane has done that to me a few times. I'll be like, okay, well, I'm here when you're ready. And then literally, like, not even an hour later, he's in my room going, okay, I'm ready. Cool. Let's
Biggest
hear it.
biggest PSA for parents out there, and I mean it. Listen, therapy is not to fix your child.
Absolutely not. We're not fixing them.
Yeah.
We're
I
teaching
think
them.
there's, and this is for the kiddo and for the parent, because like that misconception is that you're going to bring them to therapy, you're going to tell us what's wrong with them, and you're going to be like, fix it in 12 sessions. Yeah, that's not going to happen. Some things, does it take less time? Do they need less time in therapy? Sure.
Right. It also depends
But
on how
don't tell,
dedicated they are to it too.
yeah, but don't tell me to fix your kid.
Also, if you're going to put your kid in therapy, they should probably show up because if they're not coming to therapy, they're not making progress. And when I only see this kid every 3 weeks or once a month or however often you're allowing it, and like I get it, like life is crazy and you've got to work, and I will do whatever I can to accommodate you within my own schedule. But also, if your kid's not coming, we're not making progress, and then you come to me one day and go, what's happening? What's happening is you've only showed up for half of the scheduled sessions we've had. And so we've only made minimal progress because they're never here. And then sometimes you have to start that rapport building process all over again because it's been so long since you've seen them. So they're just trying to learn how to function in this world that we've kind of figured out, but maybe not.
No.
And we want to prevent them from being adults that are in therapy their whole life because they were never taught how to identify or explore or express or communicate or anything.
But that kind of goes to this next point is you don't have to be falling apart to get support. Okay, so you don't have to go to therapy just because they've had a traumatic event in their life.
No.
Many teens need support in different ways.
Yep.
Because they have ADHD, because they have anxiety. Oh, goodness gracious, please bring them to therapy if they have ADHD. Jesus.
That's always a difficult, like if there's nothing else going on and they have ADHD and it's like, well, like what am I teaching them? That was always kind of a
Executive,
struggle for me in the
yeah,
beginning.
executive functioning. Oh
Ma'am,
my goodness.
how am I going to teach someone executive functioning when mine is in on Mars? You feel me? Somehow we managed to do it. Because for a while I was not medicated, so I had to learn how to like cope through things and function without meds. And so I think that's what a lot of parents circle. I don't want to get too much on ADHD, but also in term with our adults, with my kids, anyone, you don't have to talk about anything you don't want to talk about or you're not ready for.
We'll
Now,
get to it when
now
we get to it.
I might test the waters, right? Because you've told me something in our first appointment, or your mom or your dad or whoever told me. And so I'm like, well, I'm just gonna explore here. And so oftentimes you find out, oh, they don't have a problem talking about it, or maybe it's a total red zone. And then you're like, that you've because of their reaction, or they shut down, or they get up and leave. And so then you got to repair that and be like, look, I'm sorry, bro. I was just trying to talk to you about these things. But if that's a red zone, that's a red zone, right? And some kids after that, they learn to name it. They're like, yeah, that's a red zone for me. And so then I know that I am not going to bring that up until they do. So I learned that the hard way with one patient of mine. I dipped my toe in the red zone, which I didn't fully know was the red zone. And then she was silent for like the rest of our session. And I was like,
See.
yeah, it was, yeah. But we were able to like get past it. However, I feel like she never really fully wanted to tell me things again
Recovered.
because she was afraid I was going to push her. Um, and that's
We're
that's
gonna,
the,
but that's the point of therapy too, is
mhm.
poking just enough.
Discomfort breeds change, right? No change ever came without some form of discomfort or distress. It's
Mhm.
learning how to manage that and being able to confront it, I think. But some adults don't even do that. I don't even do that. Hey, my therapist, if you're watching, I'm admitting this right now, okay?
Therapy isn't about changing who you are.
No, you might be
I think,
better for it later, but you're still going to be you.
yeah, but I think a lot of people feel like it's gonna like change who I am and what I believe. And again, there are some false narratives that go around in
We are not
circles.
brainwashing you guys. Like,
That is like the myths and misconceptions that come out, especially like older adults that
mhm.
believe like we're just a bunch of liberals out here brainwashing children
Not all
into
therapists are liberals, right?
but like, we're just out here brainwashing the youth of America into believing their fancy feelings.
We have, I don't have feelings. I have fancy feelings. My feelings are fancy.
Because gosh forbid we actually get them to help these kids to help themselves.
Right. And in line with how adults think, when I had that
Mm-hmm.
meeting with that guy a couple of weeks ago, and he's like, "Oh my God, you're gonna tell me it's all my mom's fault." And I'm like, I don't know, is it? Is it your mama's fault? Is it your
Not,
daddy's fault? Right.
not
Sometimes it
everybody
isn't.
subscribes to Freud.
Right. I mean, listen, you and I both understand the impacts of childhood and parental stuff. Like, it matters. Okay. But it doesn't mean that we're judging or making fun, because I feel like I'm talking to the parents of the teens now. We're not judging you or your parenting style or anything like that. We are focused on your kid and their issues and how to help them. If your
Sometimes
parenting
we're judging
style,
you.
right, if your parenting style comes into focus and we need to address that, that's very different. But we're still not judging you, because I feel like most people do the best they can most of the time, right? I do the best I can for my kids the majority of the time. There are times where Landon comes to me and he's like, "You pissed me off." And I was like, "Oh, okay. What did I do?" Or I already know, right? Or I'll just see it and feel it and apologize, because now I feel like crap. We want to also help you parent your kids better, because we know about them. They know you are your best. What is the phrase about like patients being the number one expert on themselves? That applies to
They're the
kids and teenagers too.
Yeah, they're their own advocate.
Yeah. And
And like
you're not an expert on me. Well, you are. That's not a good, but like
that's not a
I'm
good
not a,
analogy.
I'm not an expert on my patients and how they feel and what they've been through. They are, regardless of their age. They know way more about it because they lived it.
Yeah.
So we're not judging. And it's not a,
Therapy is going to be about everything. I
yeah.
love this for teens because they can talk about school stress. I know, I want to know so bad what Lucas talks about in therapy, but I know better than to ask him because I'm like, are you talking about friends? Are you talking about me? Are you talking about like anxiety? Like, I want to know.
That also makes me, like, because I don't know that I've ever asked Landon what he was talking about in therapy, but he surely didn't hide it from me. He would come and tell me, and I was like, honey, that you, you don't have to tell me anything. He's like, no, I want to tell you. And I was like, okay, sure, go ahead. And then he would tell me, and I'm like, oh God, I'm not paying your therapist enough, that poor girl. But
No.
right. But also, don't ask your kids what they talked about in therapy
Exactly.
unless they share it, because that makes them feel like, well, this maybe isn't a safe space. And if I go to therapy, I'm going to be obligated to tell you what happened. If you have a
You
loved
can
one in
be
therapy,
you can be curious, but
right?
like also don't push.
How was therapy today? Right?
Mhm.
Is
And
a
if they
good
go,
benign question.
yeah, if they go good and no more, don't push it.
Right. Right. Yeah. So putting your kids in therapy and you also going to therapy because you're not getting along is not failure. It actually shows that you're willing to do work to fix it. Oh, okay, I said fix it. I didn't mean to say fix it. To mend it, alleviate whatever's happening, right? Because sometimes it's not just a kid that's the problem. And I raise my hand on that, okay? I've been a much better parent to my kids, which is still in the air, you feel me? Since I've been in therapy and since, like Landon was in therapy. Because I'm much more regulated. So are they. They're learning how to talk and communicate and express things. And I am learning how to sit with discomfort. You know what I
I
mean?
love this. It's me. Hi, I'm the problem. It's me.
100%. Like, I am the villain. It's me, Jesus. Okay? Because as the adult of children, you are the one responsible for their well being. And if they're like, I need therapy and I am struggling, then you should probably do that. I also think that the perception of therapy from down the line makes a difference. Like, obviously, our kids don't have a problem going to therapy because we are therapists.
No, I
And
got one therapizing his therapist.
Landon did something similar to that. Bless their hearts. But if you're giving therapy a negative view, then your kids are going to view therapy just like the kids model that behavior. Not all of them model your mindset or your beliefs, but something like that, they would definitely pick up on and be like, oh no, I don't need to go to therapy because that means I'm broken.
Yep.
That means
How do
I am.
we normalize it? How do we
Mhm.
normalize it for these teens?
A lot of people go to therapy. Everybody you know is probably in therapy. There might be a few that don't, but
Or
we use,
shouldn't?
yeah, everybody, even adults, grown adults, old adults. I've got them as young as 5 to as almost 90, right? That's a big gap. Everybody can go to therapy to learn how to deal with their emotions, regulate themselves, learn things, right? Because especially if they've been through trauma, they don't understand the things that we're telling adults about trauma. Maybe they
Yeah,
do.
so
They're super
use
smart
real
kids.
language.
Real language, non-clinical language,
Yeah.
because you have to deal with adults too, but especially with kids, they don't understand that. Most adults don't even know what an amygdala is, so I can't talk to my teenager unless they're neurospicy, and then they're on their phone googling it, wanting to know, and I have to give them diagrams and sheets and things about it. But using the real language and then shutting up, shut up, stop talking. When you have teenage patients in there,
Why am I talking?
the weight comes in heavy because you're like, you have so much you want to say, you have so much you want to ask, but you don't want to interrupt because
Because they
that's,
have tea, and I really have questions sometimes when it is a carryover of like some drama at
I
school and
know.
I'm invested.
I do love the tea, okay? Like I say all the time, I didn't become a therapist because I don't like to hear your stuff, right? Like I am in it. You feel me? If my neighbors are arguing, I'm like, no, don't stop on my account. Please continue.
Teen drama is the best.
It is the best. Also, like they're all fighting in bathrooms and the stuff that they come tell me from school, I'm like, oh my gosh, I cannot believe this is happening. Also,
Yeah,
tell me
because
more.
it's evolved from like what we went through as teens to like theirs, because like I don't hear nearly enough about teen pregnancy as what we went
Yeah.
through to like
They
theirs
really
now.
they really nailed that down though, like they really drilled that in for our generation and the next, ideally. So yeah, I don't hear as much about them like smoking cigarettes or vapes at this point, or doing drugs or going to parties. Like, do you remember how they fear mongered raves and like ecstasy and stuff when we were younger? It was like, oh my God, you will die 100%. There is no chance you're going to survive this. You're going to overheat, your blood's going to boil, and your brain's cooking. And I'm like, oh my God. Okay. Yeah, I'm good.
No,
Right? Like,
they are, and that it's like I don't know if that's part of the problem or
I just a little bit of both, right? Like this generation coming out now that are our teens, and then like Kylie and Sawyer's generation, bless hearts of people who have to interact with that generation because they give zero, you know what?
yeah, they're feral.
They're
They're
feral. And
feral.
forget COVID babies. Oh man, Sawyer is technically, well, he was born during COVID, but my cousin has a child that's the same age as Kylie, and they are both just unhinged. And I'm like, it's the generation. It's the generation.
Yeah, but
This
We have Gen Z babies, the tail end of them.
right. Landon's Gen Z, and Kylie and Sawyer are what is that, Gen Alpha or something?
Mhm.
Yeah. Bless, bless.
An alpha teen coming in, and a Gen. Ugh.
That's kind of like how I called myself an elder millennial. I am not like, I am not. Also, I just learned the reason why we're called millennials, and I feel like I've told everybody this, and I felt like so stupid that I didn't put that together. Do you know? We are called millennials because we were born in one and then like grew up or became adults in the other.
Oh,
And I was
yeah,
like,
that makes sense
that
though.
makes so much sense, right? And some of us lived through multiple decades, like if you were born in the 80s and then you were growing up in the 90s and then you were a full grown adult in 2000s. I was like, wow, I guess that makes sense. It's true. But generationally speaking, I wonder if our parents looked at us the way we look at our kids and go, oh my gosh. In line with that, I don't think they emphasize the differences in generations as much then as they do now. Because I always have to tell people, we are raising kids in a generation and for a world, like if you raise your kids the way that your parents raised you, I'm not saying you're doing anything wrong and I'm not throwing shade, but you're raising kids for a world that no longer exists. The world that existed when we were kids is gone. This is a totally new reality that we live with everything that's happening and all the stuff we have access to and our kids have access to, right? So
Yeah,
you cannot
but
raise them the way we were.
I think that really goes into this as giving them some control because choice matters, and we really didn't have a whole lot of
No.
choice.
The autonomy is real. Like they need that,
Mm-hmm.
which is why I always try to push that. And like, if you email me, I'm going to tell your kid. If you want to meet with me, we have to ask your kid. And by we, I mean I, alone without you, because I don't want it to be influenced by environmental stuff happening, right? I don't want you to feel guilty for saying no, that I can't meet with your parents because this is your choice.
Be honest with them. You can tell them it's gonna feel awkward, and that's okay.
Mm-hmm.
Like you're telling somebody all of your stuff, and that's weird at first.
It is. It's weird for us too. As
Yep.
like when we're the patient, right? Like especially as a therapist, it's even worse. But like, I'm like, oh, all right,
Oh.
bleh, here's all my stuff, right? But then after sessions after that, I'm like, I don't want to talk about that.
Yeah, because
Yeah.
how we're gonna because things that are gonna shut this down, especially from parents, like forcing them to go to therapy, can't do it. Threatening consequences if they don't go to therapy.
Oh
No.
man,
Therapy is not a punishment.
you just hit like a nasty spot in my soul.
Yeah.
Therapy is not behavior modification. We are not trying to modify the behaviors of your kids to some degree, depending on what they are, right? There's specific circumstances. But I do not ever want to hear a parent tell me or have a kid tell me their parent said, well, I'm going to tell Brittany. No, no, that's not what we're doing here. You're not going to use therapy as behavior modification at home instead of just letting me know what's going on and then we can work through it together. That's no. Therapy is not punishment. Therapy is not behavior modification. It's for your kid to be more regulated and
Yeah.
learn and have their own space.
Yeah. Don't over explain it. Look, you know about as much as they know about this.
Right. I don't know as much about you. And that's the other thing, they don't know a lot about us or even the process.
Yeah.
I do probably over explain a little bit to them, but it's because I want them to
But that's
know
us. We're the
yeah,
subject matter expert.
that's fair.
But
That's
it's
fair.
when parents over explain it to their kids, but it's like, hey, don't do that. Keep it simple.
Say
I'm
less.
taking you I'm taking you somewhere to talk. You've had a lot of big feelings lately. Here we go.
I've found that the most successful, and I'm not trying to say my other patients, cheers too high, over under successful patients I've had, but the ones that have been the most successful with me that are in their teens actually had parents that said, okay, you need therapy. Let's go look for someone. And then they're on Psychology Today or wherever looking at our profiles and they reach out and go, my daughter needs therapy because she's hurting herself or she's super depressed or she whatever. And she picked you out of like, she said that she only wants to see you, which is like a huge honor, but also, okay, let's see where that leads. And immediately they come in and they're very trusting because they already feel like they know you to some degree because they were reading about you online. I guess now they can watch our podcast and really find out how we are.
Don't minimize their feelings during this, especially when they start opening up and they say, this is how I feel. Don't shut them down during that.
No, that's the waiting part. And then
Because
finding a solution.
Yeah, because for parents, this is just as important for y'all to listen as much as it is for us to listen.
Yeah. Yeah. And they think it's weird to share those things. I think it all circles back to being judged and not, and they're usually not able to express those things at home without being judged or told to stop, you're fine, there's nothing wrong with you, you're good. So they've have this narrative that none of this stuff is normal and I must not be normal or I must be being punished because I'm in therapy or whatever. So I love that you put broad therapy is weird. What
They
they're
are.
really what they're
Yeah.
really saying is that they don't trust it. They don't trust us. They don't trust anybody because why would they? They don't want to be vulnerable. And then I want to talk about the
Nervous.
red zones, right? It's very yeah, it is all nerves and anxiety in terms of it's funny. I have adults that say it too, but kids are like, man, I was so nervous about this first appointment. I'm like, why? Why are you nervous? That's so weird to me. But I can understand how like coming and bearing all of your stuff to somebody can be scary, but I'm like, I'm not judging you. I just need to know.
Yeah, because it's gonna feel weird. Teens, parents, it's
Yep.
supposed to feel weird.
Yep. And there's laws and regulations about what we're allowed to talk about, what we have to report, when we don't have to report. And I think once they fully grasp that, it
Yeah.
doesn't feel as vulnerable and they don't feel as exposed anymore as they did in the beginning because they're like, well, I don't know what I can tell this therapist because maybe they had a bad one before that ratted them out to their parents every single time something happened. I'm like, I'm not that girl. I'm not that person, right?
But
We're not,
we're gonna take a shift from pressure to permission.
yes, the autonomy. Yep. You have
We're
permission to
opening the
feel however you
door.
want to feel in here right now.
Mhm.
I have one that gets up and acts out everything. And I love that because I loved theater and I love tea. So he's up walking around, stomping around my
Yeah,
office, being like with this big personality. And I love that, right? Because
I
he's
love
been to
it.
therapy a lot, okay? And
Yeah.
he knows the deal. So he's just like, I'm putting it all out there because that's
Mhm.
you've got like, OG kids that have been in therapy off and on all their lives. So they know the drill, okay?
Yeah.
But if your kid is not, you know, let them choose. Let
Yep.
them decide within reason who they want to see, where they want to go, and whether they want to go in person or telehealth. I find most of my teenagers don't like telehealth unless they can go hide in the car or sit somewhere where they know they're
Oh
alone,
no.
nobody's listening.
The ones I have, they have loved it.
Yeah,
And then right now, if you're a teen listening, therapy doesn't mean something's wrong with you. You're human too, and this world is absolutely nuts right now.
100%. 100%. The world is crazy. You get to come in and choose how fast you'd like to go, what you want to talk about. You get to ask questions if you don't understand something. I'm probably going to beat you to it and just explain it
Yeah.
anyway. But you have to know that, like, our job and the people who do choose to see teens and kids are doing it because they have a niche for it and they love it and they enjoy, like, working with that age range, right? Not everybody enjoys it. Not everybody is good at it. Okay, not everybody's good at it. Just because you took a child development class in college doesn't mean that you can do therapy for kids.
Yeah.
No, it takes extensive continuing education and supervision after. Like we go through lots to learn how to counsel you, okay? Even though we were you once, it was in a different world, so it's no longer relevant.
And then especially if your first therapist isn't right for you, doesn't mean therapy didn't work.
Find another.
Find a
I'm dying on
person.
that hill. It's my Roman Empire. I was,
Find your person. Find
yes,
who you connect with, especially as a teenager. Oh my goodness. This is not one size fits all. Go find the person that you get to be unexplicitly weird with.
totally. And I'm weird. So, and I've got a wide range of weird. And I know you do too. There's something for everybody here, okay? In terms of teens, let me get a teenager that likes horror movies. Oh man, that's great. because we'd have long discussions about it.
Legos. I have Legos.
Like, see, the Legos, I don't have the patience.
Look, I do D&D. I did D&D parts today. It was fabulous.
I can't do the Legos. I will do the coloring thing. I
Mm-hmm.
like the reading thing. But Legos is something I'm like, I just know my luck. I will lose a crucial piece and then I won't be able to complete it. And then I'll be like, I'm never touching this again. But I have a lot of kids that say kids, teenagers, adults too, that play with Legos. It doesn't mean you're playing. You're not, I don't say you're a kid. Some of those things are really complicated, which is why I always pass them off to somebody else when my children get them because I don't have the spoons for the
So
Legos.
find your weird. Find your person. I love it.
Maybe we should define our weird on our
Mm-hmm.
Psychology Today profiles.
Absolutely. And I will define it as that, as my weird.
This is my weird, okay? I am freakishly obsessed with horror movies. I love to read, okay? That's fine. You don't have to like to read either. But if we could talk horror movies and heavy metal, I'm here for it. Also, 90s grunge. I have an Avril Lavigne sweatshirt on. It doesn't say it. I have an Avril sweatshirt on right now, and I don't know how many teenagers could look at me and be like, I don't know who that is, or that they do. If we could talk about...
Lucas Wood.
I love that. I love that. Because he's like an old person trapped inside.
In his he's in his 90s alternative era right now.
Oh my God. I love that for him. I love
It's
that for
just
him.
when he starts listening to like Bush Glycerin, I'm like, are we okay?
Yes. See, Nirvana, I'm like, I see people, kids, teenagers walking around with Nirvana, and I'm like, do you even know who Nirvana is? Did you see that video where the girl had the Nirvana shirt on and the guy was talking to her about Kurt Cobain? She's like, who's that? And everybody was like, take it off.
Shirt on.
Disgrace. Blasphemy. Yeah, find your weird. Find someone that fits with you. Right? I had a therapist in grad school. I couldn't stand her. Therapist I have now, she's solid. I love her. I'm not ever going to let her discharge me. And she's going to have to accept that. Because as long as I'm a therapist, I need therapy. Okay? But let's remember,
bruh isn't disrespect.
It's not. It's not. And if your kid comes to you and says, I'm not really with this therapist. I don't like her or him or whatever. And okay, cool. Let's find her a new one. Landon didn't like the first therapist he was with. And he ended up switching and found somebody that he really loved. So the first one's not always the right one. Although it sometimes can be. It's not always the case. Don't get discouraged. Find someone new.
Slow down to hear enough what's underneath it. Like real conversations
Listen to your kids.
Happen with your kid.
Listen to your kids. If they've been in therapy for a while and they're coming to you wanting to talk to you about something that happened in the past or the way that you made them feel, sit with it and listen, because they have gone out on a huge limb to come talk to you about this thing, and they probably ruminated over it for several days and talked to us about it in therapy. How do I talk to my parents about this? Just listen, give them the space, right? Without judgment or without punishment, because they're coming to you and telling you that you upset them or you made them uncomfortable or this other generic situation makes them uncomfortable, whatever. Just listen to your kids.
Absolutely.
Okay? If you take away anything from this, is to listen to your kids. And if you're a teenager and you want to go to therapy, find one.
Yeah.
The internet is free. Well, sort of.
Mm-hmm.
You have to pay for Wi-Fi, but like it's free. You can access Google for free from your phone in your pocket at any time. Psychology Today. Choose your gender. Move on, right?
Yep.
Some kids don't want to see males and some dudes don't want to see females, and that's fine. I'm not offended. If you call me and say, my kid doesn't feel like they're connecting with you or we got to find someone else, I got you. My feelings aren't hurt. Because I know without that, there's not going to be any change or progress. So it's not. Also, punishing your kids for expressing their emotions is... We're going to get more into that when we talk about little ones.
Oh, yeah.
Soon.
That one is soon.
And if I ever hear a parent look at me and say, my kid's resilient, I'm probably going to throw up all over the place.
That is a whole nother discussion.
Yes, it is. That word does not mean what you think it means. Stop saying that. Kids are not as resilient as you think, and neither are we.
I want to thank everyone for listening today. If this episode made you think of the teen in your life or someone else, just share. And remember, support doesn't mean weakness. It means you're paying attention. Like, follow, subscribe, all of the things.
Yes, you better.
She's watching.
I better not see another short or video with 120 some views and 0 likes. Okay, y'all are disappointing me, and I don't like it. Okay, share it. Share. All right. The more followers we get, more things we'll be able to do. Okay. All right. Anyways, I will jump for joy when we get to a big number, but we're moving up there. We're getting more every day. Thanks for listening, and we will see you on the next one. Have a good one. We want to thank you for tuning into this episode of Holding the Line with Got Your Six, where we are just a bunch of therapists who talk about the shit nobody wants to talk about. We hope you got something useful out of it. Stay tuned for more of our upcoming episodes every other week posted to our YouTube channel, Holding the Line GYS. If you want to help support our podcast, please like this video and subscribe to our channel and share this video with others you think may get something useful out of it. Make sure to follow us on Facebook and Instagram, where we will post useful information, dark humor, and more of the shit nobody wants to talk about. Go forth and do magical shit, everyone.
I love teens in therapy. They're so fun. Our teens in therapy are, I don't know how fun they are right now. Mine are giving their therapist a run for their money.
I don't know how fun Landon was in therapy, but I know I have teenagers who are fun. Sort of. I only have the one right now. Well, that's a lie.
Yeah, I'm about to say Riley is bullying his student.
Yeah.
The student makes it so much better. Because, like, the supervisor was like, he's giving a lot of clinical language in here, and he is therapizing the student and bullying him a little bit. And I'm like,
I know more than you. That was like when I gave Landon that Sean Koss book with all the diagnoses in it. He was sitting there quizzing his therapist over which diagnosis was which. And I was like, Landon, she knows. Like, don't stop. Stop being a turd. And he's like, I just wanted to make sure she knew. And I was like, she knows. This was a therapist who was already like,
these are the worst kids. These have got to be the worst kids to have as patients. Is, oh, great, your parents are therapist.
That should be a question on our intake form. Like, is your parent's occupation, and if their parent is a therapist, we're going to give them to a certain person or charge them more. I'm just kidding. We're not going to do that. That wouldn't be fair. But it's a joke. You guys can take jokes. They're worse. Or if their parents are like in the medical field to some degree. I've found that too. I had one that her mom was a PA or something, like mom or dad was a PA or something like that. And so she had a lot of clinical language herself, but not related to therapy, which made it interesting because she would make comparisons. But I do love to see, because listen, I could sit and talk forever about the horror movies I like and why you like them and relate that something back to something therapeutic, right? Take anything and turn it into a therapy session. Play therapy taught me that.
Teens have the best things to talk about sometimes, with the talkative ones at least. They're like, and this happened at school, and this happened, and here's the.
Do you want to see a video of these kids fighting? And I'm like, I do not. I don't want to see that. You should. In fact, you should delete it off your phone. Because now you are in it, okay? You're an accessory after the fact. You've got a video of it. Delete that right now. If you're a teen and you're listening, stop videoing fights.
I love their drama, though. I'm like, yes, tell me more. Oh, how's this little love triangle developing? And I almost need a diagram. Let's draw this out.
Yes. And I love looking at like older ones that are getting ready to graduate from high school and they're stressed about their friend group. And I'm like, listen, I know you love these people and that's valid. But in 20 years, you probably won't even be talking to any of them. And if it is, it's going to be just one. I don't know anybody that still, except for my husband, who still hangs out with someone from high school.
You leave Timothy alone.
I love Steve. Big Steve, he's fine. He's good. And he's a very good friend. However, Tim's got a few from high school. Only one that he hangs out with. I have zero. I was homeschooled too. That's unfair. That's unfair. But even when I was at school, I don't talk to any of those. They don't. I have new friends now. I have better friends now that are in the same season of life as me, which I try to incorporate that when I'm talking to kids. This season of life is ending. You're moving into a new one, and that's going to change, right? If you're a teen mom, perhaps, or your friends don't have to work and you do, puts you in a totally different season of life. And it's not bad. It's different. It's just different. That's all. My God, if you're a teenager and you need help finding a therapist, please. Psychology Day, Therapy Den. Yeah, get your parents involved.
Reach out.
Reach out. Reach out to us. We've got the social email that comes up at the end. You can reach out to any of us specifically on Psychology Today or our website. If you have questions, we're here. That's what I feel like this was all about, right?
Yep.
What is that? You've got questions, we've got answers. Whose slogan is that?
That is the
It's a slogan. If someone thinks of it, they should probably drop that in the comments because I can't remember it now.
absolutely.
But yeah, you've got questions, we've got answers. We've got you. We may not have all the answers, but we've got some that might be helpful or meaningful. Yeah, teens in therapy. And the next time, I guess we're talking about what? Kids? Little ones? We're going to talk about little ones, tiny humans, big emotions, big feelings, right? One of the two.
Yep.
What am I trying to say? Oh my God, I just blanked out. Choose the correct adjective.
Yep. And on that note, we're out.
On that note, see you on the next one.